Good afternoon, Madam Chair and members of the committee. Thank you for the invitation to be here today. To briefly situate my perspective, I am a trauma therapist who has been working with veterans, CAF members, and RCMP members for the past 17 years. I'm a clinic director at MindSpa Mental Health Centre, an affiliate within the PCVRS network. Since joining the network, we have supported nearly 100 veterans across Quebec, Ontario, and parts of Atlantic Canada, virtually and in person, in French and in English. Our virtual model has expanded access to veterans in rural and remote communities who might otherwise face barriers to care. Over the course of my career, I have seen the rehabilitation program evolve from a system coordinated directly by case managers to the current PCVRS model. Today, I'd like to offer a balanced perspective, what's working well, and where there are opportunities to improve. To start with strengths, I have seen improved access to care, particularly for veterans in remote regions. Many are now able to connect with appropriate providers more quickly without having to navigate the system on their own. This has reduced barriers and allowed veterans to engage in treatment sooner. For example, I recently worked with a VAC case manager to coordinate care for a veteran who was not yet on the rehab program. Scheduling that initial appointment took several weeks. Under the PCVRS model, once a rehabilitation specialist is involved, appointments can often be arranged within days. That difference in timeliness is significant, particularly for veterans in acute need of support. We saw this early in one of our first PCVRS participants, a veteran who was incarcerated and who would typically face significant barriers accessing care. Through the program, he was able to engage in treatment while serving his sentence, and we saw clear, measurable improvements in his mood and his overall functioning. When the model is working well, I have seen strong multidisciplinary collaborations with coordinated care across providers. I also see standardized reporting practices and the use of outcome measures to track progress and to inform the care. One of the most significant challenges I experienced early on, and one that continues to be echoed throughout the committee and some of the testimonies we heard today, is a lack of clarity and education around the nuances of the program. This lack of clarity, if left unresolved, has real clinical consequences. In response to that, I have made it a priority to maintain open lines of communication between our team and the PCVRS team, including Peter Adams and Karen and Dr. Bourgeois. We have received support when clarification is needed. Closely tied to this is a fear among veterans of being cut off from the program or losing access to services. While the structured nature of rehabilitation is intentional and important, it's not always clearly communicated. As a result, some veterans experience the program as rigid and high stakes. I want to emphasize that the system can work well when flexibility and clinical judgment are applied. For example, I worked with a veteran medically released for PTSD who had already completed a comprehensive assessment. A reassessment was not clinically indicated as it could risk destabilizing her. Through collaboration with her VAC case manager, we readjusted the plan and moved directly towards a determination of diminished earning capacity. This is an example of the system working as intended, but it required advocacy and a level of clarity that isn't always made available to veterans or providers. I'm observing a model with strong foundations and clear impact with opportunities to enhance how it's experienced on the ground. The program is working for many veterans. The opportunity now is to build that success and ensure that it works consistently for all. In closing, PCVRS represents an important evolution in how rehabilitation services are delivered. It has improved access and introduced greater structure and coordination. For it to reach its full potential, it must be clear, consistent, and well understood. When those elements are in place, the program has the capacity to be truly transformative for the veterans it serves.